Each year, 30,000 people die from influenza infection and its complications. In an effort to get ahead of the upcoming flu season, experts at Montefiore Medical Center are raising awareness about the importance of the flu vaccine. Here to tell us more is primary care physician at the Family Care Center at Montefiore, Dr. Elisabeth Ihle. How are you?
Thanks for having me on the show, Christina.
Great. Can you tell us a little bit about the flu season and why it's so important for people to get a vaccine?
Well, every year, as you said, 30,000 people die from the flu, 200,000 are hospitalized, and millions of people contract the flu and just feel terrible and have to stay home and be ill. So we lose millions of dollars in wages, time. So there are lots of things that you can do to prevent getting the flu. Frequent hand washing. It's spread by droplets when people sneeze and touch doorknobs and things like that. But the number one thing you can do is to get a flu vaccine. Now the flu virus changes every year. There are circulating strains that go around the globe, and every year the flu monitoring societies check to see what viruses are going to be prevalent in the globe that year and manufacture the vaccine to combat those strains. So every year the flu vaccine is different, so it's important to get a new one every year.
How is the vaccine this year different from last year's?
It's actually the same as last year's, which is not true for most years.
Why is that?
Because of the changes in the virus mutates very rapidly, and the strains that go around can be altered very, very substantially. It happens to be the same this year, but it's usually not, so that's a great reason to get a flu shot every year.
I know that Ebola is on everyone's mind nowadays, and they do talk about how some of the symptoms for Ebola can mimic those of like a cold or a flu. How do we know the difference of between a flu, a cold, and possible infection with Ebola?
Well, you can only get Ebola if you're exposed very, very closely to somebody with Ebola. So the odds are extraordinarily low.
Unlike the flu.
Unlike the flu. So the symptoms of the flu are typically fever, muscle aches, headaches. People can get a cough or runny nose. And typically those symptoms last about a week before people start to feel better.
So you talked about frequent hand washing as one of the ways to prevent the vaccine. I know that they were putting up signs about not coughing into your hands, but maybe into the crook of your elbow instead. Are there any other ways that we can maybe combat the spread of the phlegm or spit in the air for that?
So coughing into your elbow is a great one because then you don't get the droplets on your hands and it's harder to spread around. Using hand sanitizer, if you can't wash your hands frequently, is a great way. And just being a good citizen and not going to work or going out if you're not feeling well is also a great way to avoid spreading the flu.
Can you tell us a little bit about what the Family Care Center is and what services does it provide?
So we're a primary care facility. We offer sort of the full range of primary care, so pediatrics, women's health, OBGYN, and adult primary care. There are also several specialties that are at that center. But we're just one of 20 plus primary care sites that Montefiore has all over the Bronx. And we're all 24 of us are absolutely ready and willing to help people avoid the flu this season by offering vaccines and education.
So you can get the vaccine at any one of those sites?
Sure.
Is it free? Is it a cost? Is it insurance?
Sure. So almost all insurances cover the flu vaccine. If people are uninsured, we also have sliding scales where people can get primary care and vaccines for very, very low cost. And if people don't want to do primary care for whatever reason, you can get the flu shot at a lot of pharmacies.
Is that different from what you get at the hospital, or no?
No, typically not. There are a bunch of different brands of the flu vaccine, but all of them contain the same either 3 or 4 strains of the virus.
Okay, so there's a question. A lot of people are scared of vaccines. A lot of like anti-vacciners. So who is it safe for? Who is the vaccine safe for, and who is it not?
That's a great question. So almost everybody can get the flu vaccine. So anybody over 6 months of age, and if you don't have a very severe allergy to eggs. So the flu vaccine is recommended for anybody who wants to protect themselves against the flu. But there are certain high-risk groups that we really recommend it especially for. So kids under 2, people over 65, anybody with a chronic illness like diabetes or asthma, anybody who is immunosuppressed, and pregnant women are all people who are at high risk of having complications if they get influenza. So we really recommend the flu vaccine for them, but really anybody who wants it can get it.
That's interesting. You mentioned something about eggs. Could you explain what that is?
Well, so there are eggs involved in the vaccine manufacturing process. So most types of the vaccine are not recommended for people who have very, very severe allergic reactions to eggs. There is one type of vaccine that's approved that doesn't involve eggs in the manufacturing process. That one's a little harder to come by, so we recommend that people check with their doctor's office before they come in for a vaccine, just to make sure they have the right kind of vaccine.
Do you guys have a particular schedule of when you would be giving out flu vaccines? Do people have to make an appointment ahead of time?
You know, at my practice, we have a walk-in flu clinic Monday, Wednesday, and Friday. So any of our patients who want a flu vaccine can just come in on those afternoons and get one. Lots of the other primary care practices do too. We really feel like this is something that's important for people, so we want to make it easy for people to get it.
Thank you so much for your help today. We have to take a quick break, but